In the US, nearly half of the 20 million new STDs each year were among young people between the ages of 15 and 24, according to a study done in 2013. Now, these are national statistics. Imagine these numbers at work in your own local community. Young people often engage in risky sexual behaviors, such as having sex at a young age, having sex with multiple partners, having sex under the influence of drugs and alcohol, and most importantly, having unprotected sex. Such actions can result in unintended health consequences, such as contracting an STD or even experiencing an unintended pregnancy. The awkwardness of sex-related conversation between adults and young people, along with the monotony of reading encyclopedic sex-related information, often keeps people away from becoming knowledgeable about sex. The iOS and Android application STuD solves this problem.
STuD's game-based approach to teach students about sex keeps users engaged, unlike other applications like Sex Positive and My Sex Doctor, where users talk to experts or read text-heavy material about sex. STuD is a unique running game in which the user's goal is to obtain as many points as possible, which is done through advancing while avoiding the enemies, or STDs. Each time the user hits an STD, part of the screen is covered. This represents the user's health. The more STDs you run into, the more area of the screen is covered. Once you come into contact with an STD, an info box pops up, providing information not only about the actual STD, symptoms and prevention measures, but also how it can be defeated in the game itself. Throughout the game, you can collect coins, which can be used later for condom purchases in the STuD store. The condoms that users buy can be used for the slot machine. The game ends when you're unable to function due to your health level.
At this point, a slot machine appears, providing an opportunity for users to raise their score. The slot machine was designed to teach users about risk-taking in real life. To avoid the risk of STDs, users can use a condom when using the slot machine. Otherwise, they have a 75% chance of contracting an STD and losing points. The medical library provides a compilation of all the STD information and serves as a metaphor for a medical clinic or doctor's office. The user can reference the library to learn about the symptoms, treatments, and preventative measures for a comprehensive list of STDs.
With our free application, users can have fun while learning about an otherwise mundane topic. Our main target market are adolescents aged 12 to 17. Parents and educators play a central role in letting them know about the application. For example, for students who take sex education classes, we would inform educators of the app so that students' learning would be enhanced with something that is simultaneously fun and comprehensive. We will also promote STuD through social media and referral benefits as well as sponsor partnerships. In addition to advice about preventive measures and treatments, STuD also offers information on advice outreach via hotlines. We also plan to incorporate user feedback from App Store reviews and customer satisfaction surveys to improve our app in future updates.
When we surveyed over 100 sexually active students at a school, only 48% said they used a condom the last time they had sex. Our goal is to increase that number to 83% after 3 years. Our revenue model is mainly based on freemium. Since STuD is free to download in the App Store, focused revenue streams would include in-app purchases for in-app currency to buy power-ups, characters, and upgrades of the two from STuD Store, along with sponsors like Trojan, Durex, and other condom companies and clinics like Planned Parenthood.
Through vigorous marketing, there will be a total of 33,000 downloads by 3 years. These projections are based on other sex education apps, which reached over 36,000 downloads in 2 years. Because of STuD's strong competitive advantage, these numbers are considered very conservative. Sex education is a necessary component of public health, and given the features and potential of STuD, our application offers just that and more.